As many of you know, we owned and operated the hospice facility in Donnell for a long time. We had great staff, great quality, and a great service. Unfortunately, was struggling financially. And so we were looking for a way to make that program sustainable to keep it in the community. And so we found a great partner with Concordia. They've done this around the city of Pittsburgh. We partnered with them, brought that joint venture here many years ago, and it's continued to provide the service here, flourish, and do what we set out to do, which is expand the service, make it financially viable, and continue the great legacy we've had here for decades.
Hospice is extremely important to families and patients because these families are often coming to us in their most vulnerable moments, a moment sometimes of crisis, a moment of stress, and really our main job is to provide that relief for them. We have the answers to questions that they haven't even thought of. There's 4 different levels of care for hospice itself. Really, the way that we define it is based on the clinical needs of the patient and the patient's goals. Some patients are very adamant that they want to pass at home and receive the care at home, and we do our best to make sure that we service that, while some families are just very overwhelmed by the situation and prefer to have their loved one at the Donnell House or at a long-term living facility. So we're able to provide that care really in any setting that is appropriate for the patient.
Our family was exposed to hospice care as a result of treatment for my uncle, Angelo Falcone. Angelo Falcone was a true unique spirit. He was an entrepreneur and had a significant impact on Washington County. As he got older, his health began to fail, and while we were able to care for him for a significant period of time, at the end of his life, he suffered a stroke. And for all of us in the family, we were in uncharted waters. We had never dealt with those kinds of issues before. And we were very fortunate when the physicians with the Washington Health System explained to us that the next logical step was care through the Donnell House and hospice care. So for the first time, we're actually exposed to those kinds of issues. And it was truly a profound experience because the care, the concern of all involved at the Donnell House was exceptional. They cared for Angelo as if he were a member of their family, and for us it was critical and greatly appreciated. And as I indicated, we were for the first time addressing issues that we had never addressed before. And we so greatly appreciate the care that Angelo received that from that day forward, we've made sure that supporting the Donnell House and hospice care is part of our commitment to the community.
We take care of many symptoms that are not just pain. There are too many to even list, but we try to make the treatment of those not get in the way of their interaction with their family and friends and loved ones. So that's the difference, and I think a lot of people think it is just, and a lot of people think it's only for like Rosalind Carter, it's for the last 2 weeks of your life. Well, that's not really true. That's why it's 6 months, because we'd like to give support to not only the patient, but also the family, and help them work through this process, because it's a difficult process.
Yeah, the Donnell House is unique. There's not many of them anymore, and they've been closing across the nation because it's hard to make them sustainable long-term from a purely money perspective. And so working with Concordia Hospice of Washington, and the Washington Hospital, the Washington Health System entirely, we're trying to make sure that we keep that community asset in the community to take care of our patients. It's a great resource for our patients who need it.
The Donnell House allows us to take people who are having symptom management problems at home. We manage most of them at home, and so we change medicines and do things. But there are some people you can't get under control there, and you need a specialized place to do that. So we bring them in, and we do intensive management of their symptoms. It's a great organization as far as the people who actually do the work and go to the houses and go home, and all the issues that go on in homes, families and poor conditions and living alone and all those things. We're able to help them kind of get through, and it's these people who do it, and they're very, very dedicated. It's unbelievable, really.